physicians, doctors, and medical professionals are finally entering the 21st century. We're finally getting comfortable with technology, and more companies offer telemedicine. Basically, a patient, your patient, anybody else's patient, can go on a website, like WebMD for instance, and they can pay a small amount, and they can actually be connected with the live doctor via chat, or video conferencing, or teleconferencing, depending upon how the system is set up. And for a small fee, that patient can get his or her questions answered and be treated. Now, this is not for a complicated condition. Of course, heart failure, advanced diabetes, or any sort of cancer will not be treated over the phone or over telemedicine rather, but simple things, a sinus infection, or a cough, or a simple skin rash could safely and effectively be treated by telemedicine. And everybody wins. The patient wins because they don't have to go see a doctor. They can do it from the house. They can get care very quickly. And a doctor wins because they get paid cash. There's no insurance for the most part for now. It's just a cash paid service where physician in a very short amount of time gets to chat with the patient and treat them. And then depending upon your or physician's level of comfort, you can do a number of these patients per hour. And in fact, your compensation rate is probably more that you get at a clinic right now. More and more companies are starting out right now offering various types of products, various types of services, making it very lucrative for physicians and patients alike to be participants in telemedicine. Now, does that mean that you need to stop your practice, drop everything, and get on a computer and start seeing patients? No, it doesn't mean that. It's just that this is yet another tool, another mode of practice, so to speak, at your disposal as a physician. Times are changing and reimbursement rates are changing. It is to your best advantage to be informed and to know that there are many forms of practices, many modes of practices that you can do that can actually help you, and help you not just in a financial sense, but also in a burnout kind of sense. The advantage of telemedicine, for instance, is that you don't have to have set office hours. You can still have time with your family, you can still tend to your children if need be, and when you have time, you log on and then you treat patients. Some may say, well, I don't like that. I like more of a structure. I like the structure of traditional practice. And there's nothing wrong with that. But one thing to remember is that it's good to have a choice and know what you can do with your time and with your profession. Again, I'm Dr. Alexander Lakowski, and I thank you for listening.